Talking about deaths that are caused due to the surgical procedures, it is a part of the definition even that the deaths that are caused due to the surgical procedure can be due to the anesthesia that is given before the surgery is performed. So it depends upon whether it was a general anesthesia or whether it was a local anesthesia, but deaths have been reported even with general anesthesia and even with the local anesthetics. So one has to be quite vigilant while taking the history of a person on whom the surgery has to be performed, whether he is allergic to any particular group of drug or not. And if yes, it has to be reported to the surgeon who is going to perform the surgery on a particular person. So basically the time period for these deaths due to the that were caused due to the anesthesia that was given is quite short, because if it is a surgical if it is an allergic reaction that basically was found to be the cause of death in a particular case, and this allergic reaction was due to the anesthesia, it has to be quite a short period of time, more or less it has to be a few hours after the anesthesia has been administered. And if it is later than that, then we cannot be sure whether it was an allergic reaction to the anesthetic agent that was being administered or not. We have a lot of different anesthetic agents that are being commonly administered. It can be the inhalational agents, and it can be the short-term inhalational agents as well as the long-term agents. So all of these maintenance agents as well as the short-term inhalational agents have proved to be fatal in different situations. So one has to be quite careful, and these deaths can be prevented if a careful and a vital history is taken on part of a medical officer. And if it is not taken, it is basically the code of neglect on part of the medical doctor or the medical officer who took the history in a particular case. So working as a practitioner, you have to be quite careful in such cases. Now in this section, basically we'll be discussing the hazards of regional or epidural anesthesias. So again, it's quite important that we basically focus on this fact that what kind of anesthesia was given. Was it a regional anesthesia? Was it a local anesthesia? Or was it an epidural anesthesia? So there are a lot of side effects even for the epidural kind of an anesthetic. And it can be even a nerve damage, or even the person can be paralyzed after the epidural anesthesias in a lot of cases. A lot of cases have been reported after the epidural anesthesias. Now, the malignant hyperthermia is again a very important condition. It's basically defined as a rise in the temperature after the anesthetic agent is administered. And there is basically rigidity in the body of the person who is suffering from this malignant hyperthermia. So even we have to treat this malignant hyperthermia in detail over here. And we have to be very careful, and we have to look for whether the person is going in any hypothermic state. We have to be quite vigilant while recording the temperatures whenever we are administering anesthesias in a particular person. So all of this will be discussed over here in this section in detail. Now, there are a lot of complications that occur after the anesthesia is administered, and you can look over here. It's basically an intracranial hemorrhage has occurred in almost 2% of the population, and it's the middle cerebral artery infarcts. It's one of the complications that has occurred in almost 1% of the population. Then there can be the focal deficits. So it's again very important, and 1% of population is reported of such condition. And then we have behavioral problems in a lot of people after the anesthetic agents have been administered. As I'm already emphasizing, it can be a general anesthesia on one hand, and it can be an epidural or a local anesthesia or a regional anesthesia on the other hand. Then we can also come across these electrolyte imbalances in a lot of patients. So we have to basically be quite vigilant and get the potassium and the sodium levels, and all of these electrolytes have to be balanced whenever we're administering a particular kind of agent as an anesthetic. So other people have reported with fever, and they have reported with unconscious states. So all of these falls and fever, they are again the side complications or the other complications that have been reported by a lot of other people. Cardiac arrest is basically one of the leading causes of death whenever we are considering deaths that were caused due to the anesthesia. So it can be due to any allergic reaction that occurred after the anesthetic agent was administered. Then moving on, basically, we'll be discussing the hypoxic conditions even over here that can arise after an anesthetic agent was administered and the person is going in a respiratory failure condition. So all of these are also going to be taken into account. Respiratory failure is again one of the leading causes. And then the pre-medications. So even we have to take into account on what medications the person was before the surgery or before the anesthesia was given to the patient. The patient may show allergic reactions to a particular kind of a medication that was given orally or that was given intravenously before the main anesthetic agent was given. It is again going to prove fatal for a particular person. Airway obstruction is again one of the leading cause over here, and even this can be considered as the mode of death in deaths that are caused due to the anesthetic agents. Regurgitation of the gastric contents. It can be basically one of the causes that the gastric contents are aspirated and they're found in the trachea or in the bronchioles on either side, and they can be sufficient evidence that can prove that it is basically the evidence of the regurgitation of the gastric contents that prove to be fatal. Physical faults are again one of the causes that can be taken into account. It can be even the neglect of the scalpels or the forceps, and it is sometimes left behind in the abdominal cavity or even in the thoracic cavity and after the surgical procedure, and the person can go into a septic or in a septicemic condition in such a case. So the hazards of the local and the epidural anesthesias, they are taken into account. Direct nerve damage. Whenever we are considering the epidural anesthesias, it is basically the nerve damage that has to be taken into account over here. So spinal hematomas are again one of the leading complications. Spinal infections, they are also sometimes the cause over here. Drug errors, they are also taken into account whenever we are considering this fact that it can be some drug allergies that cause death in a particular case after the administration of a particular local or an epidural anesthetic. Systemic toxicity is one of the leading causes over here. Respiratory depression is also taken into account, and that is one of the leading causes whenever we are considering the local and the epidural anesthetics. Hypotension can occur and the person can go into shock-like state, confusional states, or the person may be found unconscious, and pruritus, urinary retention, and nausea. There are the minor complications, and even it can be a technical failure. Now, malignant hyperthermia is defined as a rare and a pharmacogenetic disorder of the skeletal muscle, which is triggered by the halogenated volatile anesthetics, depolarizing muscle relaxants, and strenuous exercise or the heat exposure. So even it is described in this definition that what will be the sign and symptoms in such a condition. So to negate such a condition, family members have to be investigated and muscle biopsy has to be taken whenever we are considering malignant hyperthermia as the cause of death. Then we have to take the in vitro muscle contracture test. This is again one of the evidence that has to be proven, and no specific autopsy features are found whenever a death has been caused due to the malignant hyperthermia. So in this section, basically, we dealt with how anesthetic agents, whether they are of the local kind or whether they are of the general kind, can prove to be fatal in a particular condition. So that is the end to this section. Thank you for watching sqadia.com.